Hi, I'm Kevin Knaus with InsureMeKevin.com. A frequent question I get asked are, what are Medicare Advantage plans? These are usually from people who are transitioning from an individual and family plan or employer-sponsored group plan into Medicare. And they are being bombarded with all kinds of information about Part A and Part B and Part D drugs and Medicare Advantage and Medicare supplements, and it all becomes kind of overwhelming. A very short answer is that a Medicare Advantage plan is very similar to a traditional health plan that most people experience today, with predictable deductibles and co-payments and maximum out-of-pockets. Now, that contrasts to original Medicare, which is kind of like this old car with a rag top. It gets you from point A to point B, but it's got some leaks to it, and there can be some issues. It's not like one of the new cars, the new health plans, traditional health plans that we are familiar with, that have all the latest and greatest safety features on it and get great gas mileage and warranties. So that's kind of a Medicare Advantage plan to a certain extent, but it does not replace Medicare. You are still in original Medicare when you enroll in a Medicare Advantage plan. And so a lot of people ask, well, what's wrong with original Medicare? And again, there's some serious deficiencies for some people with original Medicare. Now, original Medicare is Part A and Part B. Part A is your hospitalization. So if you go into the hospital as an inpatient, spend the night there, you will have a set deductible for the first 60 days. I believe it's $1,408 for 2020. And Part A also picks up hospice and some home health care and skilled nursing. Part B is your outpatient coverage. Doctor visits, labs, tests, x-rays, durable medical equipment. So that's original Medicare Parts A and B. So one of the first deficiencies we see is there is no prescription drug coverage in there. That will cover you for drugs administered in the hospital or in a doctor's office sometimes, but not at a retail pharmacy. Now that Part A, yeah, the deductible is $1,408, and that lasts for a 60-day benefit period, and it can reoccur if you're hospitalized more than once. Now Part B has a lower deductible of $198, and then once you've met that, you go into 20% coinsurance. So if the office visit costs $100, you pay $20. The problem is it's always $20. There is no cap to that. So if you're getting into really expensive tests, you're paying 20% of maybe a special MRI that costs $1,000 or $2,000. And so that can get real expensive real quick. So, and the big problem is that there's no maximum out-of-pocket on any of that. Now, it's okay for some people, but it's still a risk. It's still a liability that you're having to potentially shoulder. The other deficiency, again, as I've mentioned, is that original Medicare does not include any prescription drug coverage. They have developed Part D of Medicare, which covers prescription drugs at a retail pharmacy, and it helps lower the costs. And that's a whole other topic. But to have a complete package, you need Part A and Part B and Part D. And the way Medicare puts it all together, they call it Part C, and they call those Medicare Advantage plans, because those Medicare Advantage plans cover the hospitalization, the outpatient, and prescription drugs, and they give you a maximum out-of-pocket cap, plus some other things. So they're more like a traditional health plan that everyone is used to. Because the traditional health plans, like I've mentioned, they have deductibles and copays and coinsurance, and we know exactly how it's structured. Original Medicare, you start it up and you go from point A to point B, but you don't know what's going to break in between. With a traditional health plan or a newer car, you kind of know what's going to be happening. So the Medicare Advantage plans take some of the risk and guesswork out of being in Medicare. Now, Original Medicare, one of the big benefits is it is like a giant PPO plan. You can be living in California, spend several months a year in Florida, and go see a provider in Florida, a doctor. And as long as that doctor takes Medicare assignment, you're going to be seen and everything's going to be covered, and it's great. There's no problems. You can see anyone in the United States, and as long as they take Medicare assignment, you're good to go. The Medicare Advantage plans, like a traditional health plan, usually have networks that you must adhere to, because if you go out of the network, there may not be any coverage. And Medicare Advantage plans come in many different flavors or plan types. We have the HMO, Health Maintenance Organization, which requires a primary care physician to be selected. And then that PCP will then make referrals to specialists for you and order different imaging tests and whatnot. And for many different routine healthcare services, you must see your primary care physician. We are seeing more and more Medicare Advantage PPO plans, but they still have a network within a particular region, usually within a couple counties or a state. And if you go out of the network, you may get some coverage, but it may not be covered at all. With an HMO, there is no out-of-network coverage. And that presents a problem for some people who may be traveling during the winter or the summer for extended periods. There's also the private fee-for-service plans, special needs plans, which were really good if you are dual eligible. You're eligible for Medicare and Medi-Cal or Medicaid. And there's also some chronic special needs plans for people with chronic health issues. There's HMO point of service plans, there are Medicare savings account plans, and there's a cost plan. So, and not all of these plans will be offered in your county. That's why you have to go to Medicare.gov or work with an agent to find out exactly what plans are being offered in your county. And then you can kind of dig into some of the details and how those work and whether they're going to be right for you. Even though you enroll in a Medicare Advantage plan, you're still in Medicare. You're never going to lose parts A and B, okay? That will never go away. But all the claims will be handled by one entity, that insurance company or the plan sponsor. Now, you can change plans every year during the annual enrollment period from October 15th to December 7th. You can switch plans. You can drop that plan that you're in and go back to original Medicare if you would like. And one of the ways people often wonder about how these plans are able to exist is that they contract with Medicare, and then Medicare pays them a monthly amount, a capitation rate, sometimes $800 or $1,000 a month and more for each enrolled member. And for that monthly rate, the health plan, the Medicare Advantage plan, assumes all the risks and liabilities associated with the costs of your health care. So that's one of the ways they do it, but they're more like a traditional health plan that we're used to, and that's comforting to some people. Medicare Advantage plans have many positives for some people. All of your doctors and hospitals may be in the network that you want to see, and so that's good. There's an annual maximum out of pocket, which is really, really important, which we do not get with original Medicare. Guarantee issue. So once you have original Medicare Parts A and B, you can sign up for any Medicare Advantage plan either in your initial coverage period or the annual election period, and they must take you. There is no pre-existing conditions. It doesn't make a difference what your health challenges are. You will be enrolled in that Medicare Advantage plan with prescription drug coverage most of the time. They have predictable co-pays and co-insurance, and so that gives a sense of safety that you aren't going to be hit with huge bills. A nice summary of benefits with these Medicare Advantage plans. It's managed usually just by one company. So sometimes it's nicer to deal with one, albeit a large company, but it's nice to deal with one company as opposed to a big federal bureaucracy if there are issues. And the Medicare Advantage plans may include extra benefits like dentistry and optometry, sometimes podiatry, and wellness programs, and sometimes hearing aid as well. So that might be a great benefit, but you should always check with your current providers of those ancillary benefits to see if they participate in the particular Medicare Advantage program that's being offered through your plan. The overall costs may also be lower. As opposed to being in original Medicare with a Medicare supplement and a Part D prescription drug plan. Sometimes the costs are just lower if you're not Medicaid eligible with a Medicare Advantage plan, and that can be really important for some people. And again, you may have original Medicare with a supplement, but 10 years down the line, you can segue into a Medicare Advantage plan with no problems, no questions asked. Now, there are some downsides, some negatives to Medicare Advantage plans. Again, a network of providers. So if you are used to seeing all kinds of different doctors and different medical groups, and they're not all in one medical group or one particular area, that may be an issue. If you frequently travel outside of your state or county for extended periods of time and just want routine care, the Medicare Advantage plan may not be able to support that because their network may not extend that far. Because some of them do require a primary care physician for referrals. One thing I will mention though, emergency care, no matter where you're at, regardless of the Medicare Advantage plan, will be covered. A life-threatening situation, always go to the emergency room, and no matter what Medicare Advantage plan you have, it will be covered. And then sometimes you also need to check with the prescription drugs that are in the formulary to make sure that the drugs you are taking are in the Medicare Advantage plan at the best tier. So there can be some downsides. Overall, though, a lot of people do like the Medicare Advantage plans because it's all one nice, neat little package, and they don't have to worry about supplements and Part Ds and looking at that every year. But that's kind of the big overview of Medicare Advantage. There's some really good aspects to them, and then for some people there are serious drawbacks. But then again, as we just saw, original Medicare has its deficiencies as well. So if you have any questions, please reach out to me. You can go to my website, insuremekevin.com, and send me an email, call me on the phone. I do answer the phone, or you can leave a comment down below. Thank you very much. Take care.